Hello, I'm Dr. Laukkanen, and I'm going to talk about the idea of a seroma or a hematoma that can form after a person's had a lumpectomy for breast cancer. And we'll particularly look at things we need to consider if radiation treatment may be in the picture. And thanks very much for joining me. And if you're watching this in anticipation of a consultation appointment with me, I look forward to seeing you. So first of all, what is seroma or a hematoma that can form after a lumpectomy? Well, it's a fluid collection, and it forms in the cavity that's created when a segment of breast tissue is removed. So if there's a lump in the breast and a surgeon cuts around it, removes some tissue, there's a potential space that's formed, and the body fills that space, typically with fluid and sometimes with blood. So if it's mainly blood, then it's like a bruise, and we can call it a hematoma. And the place at which this seroma or hematoma forms might be close to the surface if the tumor is close to the surface, or it may be quite deep inside the breast. But whether it's near the surface or deep, there's always a line of connection from that cavity to the outside, because obviously the incision comes from the skin down into that area. And most of the time, the formation of one of these seromas is a normal process, and it gradually fades over time. The fluid that forms in that space is gradually absorbed, and some fibrous or scar tissue forms in its place. And the picture that you're looking at, where there's that a white circle, you can see that area, which is a place where a lumpectomy has been done. This is from a cross section of a CAT scan. So if we compare the two sides, on the right side there's normal breast tissue where we're looking up from your feet, and on the left side there is one of these resolved seromas where there's just a bit of scar tissue that's left. Now, rarely a seroma or a hematoma can be large. It could even be the size of an orange. And here we see such an example. And when that happens, there can be associated signs that the body is reacting. There can be signs of inflammation, extra tissue fluid that leads to an impression of thickening of the skin. There can be redness, other signs of inflammation. And again, in this picture, when we look at the side where there's this obvious large seroma, there's where the pink arrow is pointing, the surface, the skin, looks thick in contrast to the opposite side. And if there is a larger seroma or hematoma, one might see associated infection, and it can be either within just the soft tissues, the so-called cellulitis, or it could be an abscess where there's a localized area right in that cavity and it's kind of walled off. Sometimes it can be hard to tell whether a large seroma or hematoma is infected, because just the process itself can create this inflammation or reaction without necessarily having any bacteria in the area. Now, sometimes those large collections can be under some pressure, and a person could notice that the area just spontaneously drains through the incision. And so they might suddenly notice quite a large amount of fluid, whether it's sort of clear fluid or bloody fluid or looks like blood. And that might be alarming, but typically it is just a drainage out of that cavity, and it's typically not a problem. The idea, of course, is that there is that drainage path from that area out to the skin. And so it's the natural place where drainage would spontaneously occur. Now, whether small or large, eventually over weeks to months, these things settle. Sometimes a drainage procedure can be helpful if it's tense or under pressure, or there's a lot of reactive change around it, and a surgeon is in the best position to make that decision, and particularly the surgeon that carried out the lumpectomy. This set of pictures shows an example of someone had a very large seroma, and over a period of months, it settled to just that small thing that we see on the right side. So just to summarize, these seromas or hematomas can form as a natural consequence of having a lumpectomy. Some settle on their own, and indeed most do, but rarely they can be large. And if they're large, they can create problems, inflammation, pressure, and so forth, and they have a greater risk of becoming infected. And if so, they may need antibiotics or drainage, or they may drain spontaneously on their own through the skin surface. They eventually settle. And one reason to take these things into account if one is even contemplating radiation treatment is that radiation can potentially delay healing. Radiation can potentially cause more fibers or scar tissue to form. And so one wants ideally to have one of these things settled before starting radiation treatment. And there are occasions where one might say, if radiation is an option rather than a necessity, that this is something that should be weighed in making the decision for or against treatment, just to minimize the number of things that can cause potential tissue disruption or so-called fibrosis to the breast. So thanks very much for your attention.